heart attack, especially, is when there's not enough blood flow or oxygen going into the heart and there is some tissue damage. People that are at risk of heart attacks, especially, are people that already have comorbidities like hypertension, diabetes, or who are smokers. Males are more at risk than females to have a heart attack. There is not an exact difference between men and women in terms of heart attacks. There is just more of a risk for men than women, and men sometimes present with more of a classical or presentation for heart attacks. The major symptoms of having a heart attack is having chest pain in the substernal area, which feels like a pressure type of pain, like if an elephant was sitting on your chest. Sometimes that pain can radiate to your jaw, neck, or left arm, but occasionally it can radiate to both arms or the right arm only, but majority of the times it radiates to the left arm, and the pain is associated with shortness of breath, nausea, vomiting, or diaphoresis. You should call 911 when you're having this type of present with this type of symptoms, and you already are increased risk of having a heart attack, especially having a history of hypertension, diabetes, or being a smoker, or family history of cardiovascular disease. When you're having a heart attack and the EMS arrives at home, they're gonna do like a small EKG. They have a strip of your heart rhythm, and that's gonna tell them if you're having STEMI, which is an ST elevation myocardial infarction, or an NSTEMI, which is a non-ST elevation myocardial infarction, because the treatment of both are different in terms of an emergency. If you're having an STEMI, which is ST elevations on the EKG, you're going to be brought to a hospital that has a cardiac cath team available, that they should be able to do a cardiac catheterization in less than 1 hour prior to the symptoms starting, and that's when they take you to the cardiac cath, and a cardiologist specializing in doing that procedure is going to do the procedure and go into your heart and see where the blockage is and try to open up the blockage to resume the flow of blood to that part of the heart. After the cardiac cath, if there's no complications, you're going to be transferred to intermediate medical care or telemetry floor, depending on the selection from the cardiologist that performed the procedure, and you're going to be put on a number of medication to help reduce the risk of having another heart attack. Usually people are in the hospital between 2 or 3 days after having a heart attack. It depends on how big and how the procedure went before they're sent home. And they're sent home with the prescriptions. Very important for the patient to take the medication that they're prescribed in the hospital. And they are also sent with some very strict instructions not to do any physical activity that might put them at harm of having another heart attack in the next few weeks prior to seeing the cardiologist at his office.